Hi, I'm Kevin with Baby Brace, which is a back brace for pregnant women. We're going to go ahead and do a demonstration of the brace right now, and it's panels that come along with the kit.
Great.
So, Baby Brace is going to look like a back brace you see the UPS, Home Depot people wearing at work, because those people get issued braces to prevent themselves from injuring themselves as a result of working. Baby Brace is going to be issued by your OB provider, basically to handle the stresses of the back pain, round ligament pain, or C-section recovery that the pregnancy is going to create, or that the pregnancy is aggravating a pre-existing condition. So let's go ahead and put it on now. So we're going to put it on like a belt. Make sure it's on your back where you want it. Feels comfortable?
Mm-hmm.
Okay. And we want to go left and then right, but below your belly button. That's the most important thing for the main brace arms. And then the adjustment arms, you'll grab them with me so I don't pull you off balance. Do you feel the...
Okay, yep.
So it has a pulley system in the back, and that's what we just engaged with the adjustment arms. So what is the brace doing? Well, basically, before you got pregnant, your center of gravity is relatively neutral, meaning your abdominal muscles and your back muscles are working equally to keep you upright. Once you get pregnant, most of the weight is going forward. So your center of gravity starts going forward, and if you don't want to trip over your toes, what do most pregnant women do? They have to arch their back. That's called lordosis of the lumbar spine. So you have a sagittal plane imbalance. So the brace, the reason why we use the belly button as the landmark, we want the main brace arms, it's going to basically cradle the underside of the belly, like cradling hands, providing support and taking some of the weight. So the first thing that's going to happen is you may find your posture improves. Now it's not going to be neutral, but any improvement is a plus. The rest of the brace is providing support to the sagittal muscle groups, which control forward and back motion, and coronal muscle groups, which control side to side. Basically, in layman terms, all the muscle groups, while the brace is on, get a chance to not work as hard, recover the muscle groups, so that when you're taking the brace off after wearing it consistently for a few weeks, you find that the pain does not come back immediately. Now, the longer you go without the brace, the more the muscles are going to have to work, and the pain is ultimately going to come back. Mm-hmm. And I mentioned to most pregnant women is that if you're having back pain during the course of the pregnancy, it's likely you'll have it afterwards, because again, during the pregnancy, the spine is getting out of alignment as a result of the pregnancy, but once you deliver the baby, the spine's now getting moved again back into alignment. And any kind of movement like that is considered trauma. Yeah. So until things basically subside, that's when the brace probably doesn't have to be used. Now the brace comes with two additional panels. A front panel, which is typically used most of the time for C-section recovery, can be used for round ligament pain. The brace typically handles round ligament pain, but if it's severe, you may want to use the front panel. Then it comes also with a back panel, because if the brace itself isn't providing the back pain relief that you need, the back panel can be used. Now these both Velcro in to the panels on the inside of the back or inside the front, and provide the additional support, and they're completely modular, meaning that if you wear it for a while and you find your back pain is under control, but you want to take it out because it's a little uncomfortable, you can do so. These are made of thermoelastic plastic, which means while you're wearing it, your body heat warms up the plastic, and as a result of the brace holding it to form to your body, as your body changes, the panels will also change along with you. Okay, and that's it.
Awesome.
Wonderful, thank you. And all of our patients can ask their providers for information about the baby brace so that we can get them prescribed.
And it's covered by most insurances, including Medicaids, whether Medicaid straight or Medicaid HMOs.
Great.
Yeah.
Thank you very much.
You're welcome.